Hi everyone, this is Dr. David Pham at Arbo Dental Care. I'm excited to bring to you a video that you never really see anywhere else. And that is going over an image of an x-ray and what it looks like in the mouth as well from the same angle. These images were taken from a journal article examining the depth of cavities, and that's why they have these images. So what they did was that they took the x-ray first and then they cut the tooth in half to show what the cavity looks like inside. So when we take a look at these x-rays, I made some annotations here to show the enamel, which is the whitest, brightest part of the tooth, and the dentin, which is on a little bit more gray on an x-ray, but it's on the inside of the tooth. And then we have the pulp here, which is in red, which indicates where the nerve and the blood vessels are of the tooth as well. So taking a look at the x-rays, most people have actually seen their own x-rays. So when we take a look, what I notice first is that how large there is of a shadow here. The shadow represents how deep the cavity is. And when we take a look at the tooth on the bottom, we can see that it actually is a very dark discoloration in the tooth. It's very noticeably different than the rest of the tooth, where over here we can see that the enamel is very, very bright, very white as well. And on the inside, it's a little tinge of yellow, which is the dentin. On this side, that discoloration, the red and the orange, it's the most intense towards the outside of the tooth, but gets a little more faded as we get further in. Even still, that does mean that bacteria has already started to destroy the tooth, and it's heading towards the nerve or the pulp. In this case, we can actually see that in order for us to do a filling, we would actually have to remove quite a bit of the tooth, and most likely that if this was still in a patient's mouth, they would feel quite a bit of sensitivity after, because the bacteria has already gone so close to the nerve. The interesting thing is that on a different tooth on the right side here, we can actually see there's a cavity on the top x-ray as well on the right. We can see a small pyramid here, but which is a lot smaller than the one on the left. Yet in real life, after the tooth has been split in two, we can actually see that the cavity goes quite deep, and we can even see some small thin lines of cavity heading towards the nerve, which likely means this tooth was already infected with the bacteria. And in order for us to remove this cavity, we have to cut quite a bit of the tooth out in order to keep it in there. This could have all been prevented in both cases if the filling was done at the threshold of treatment. So when we look at x-rays, we always look at the border between the enamel and the dentin. And once bacteria has passed this border, or once the shadow has passed the border on an x-ray, it is time for a filling, and that we can no longer just observe or monitor it because it has already passed that threshold of treatment. There is no way for a toothbrush, toothpaste, mouthwash, floss, none of that can penetrate through the tooth because it's still a hard outer shell. But microscopically, the tooth is very porous, and that's what allows the bacteria to continue to grow and multiply inside because it's still getting the nutrients from the sugar in our diet to continue to grow and then to continue breaking down the tooth from the inside. Hopefully this never happens to you, and I hope that this was also very insightful and educational. The next time you come in, we'd be more than happy to go through your x-rays and take some pictures as well, and hope to see you soon. Thank you.